By C&O standards, culture is defined as the learned values, beliefs, norms, and way of life that influence an individual's thinking, decisions, and actions in certain ways.
Food and drink in French Canadian culture. Traditional French Canadian food is often rich in fat and meat, as seen with tourtière, a meat-filled pie with a rich, lard-based crust. French Canadian settlers also shipped large quantities of wine from France, which has then led to a prevalent drinking culture found in French Canadian communities today. Most traditional French Canadian foods are typically eaten during seasonal celebrations such as Christmas, so there is little concern as to how eating habits are affected by French Canadian culture. However, alcohol consumption can negatively affect health, since drinking too much alcohol could cause chronic health issues. The short-term effects of alcohol could also be deadly in cases such as drunk driving. If a patient voices concern about potentially having a diet with too much fat or alcohol, health teaching on the behalf of the healthcare professional is vital. This could potentially mean using a translator or French materials in order to properly communicate the information to the patient and the use of various teaching strategies.
Language barrier in the French Canadian culture. The French Canadians' language barrier is a main concern for nurses who do not speak French, as a translator is needed so that a patient can communicate with the healthcare professionals in the French language. When an English-speaking nurse cannot speak the language of the patient, difficulties arise affecting the patient's ability to understand symptoms. Also, the nurse's ability to empower and influence a patient becomes negatively affected. When a nurse does not get a translator, there is an increased risk of miscommunication, which can increase the risk of medical errors and inappropriate treatments to the patient. A patient may receive language assistance from either an interpreter who works with the spoken language between English and French, or a translator who deals with written language. While a nurse or physician may be the person providing the care or describing a medical procedure, a translator helps to ensure that the client and family understand both words and meaning in the moment which they are being used.
Religion in the French Canadian culture. Religion is an important aspect in the French Canadian culture. French Canadian religion does not make anyone practice, believe, or associate with any particular religion. Instead, they are accepting of people to openly practice anywhere. Nurses should first establish a trusting relationship in order to accommodate for their clients' beliefs. Nurses have to ensure cultural safety by accommodating for patients' religious needs and beliefs. The CNO says that a nurse must first understand a client's culture, which can consist of religion, morals, beliefs, etc., before caring for them. A client's culture can become a barrier in the treating process. It is a nurse's job to compensate for these obstacles in their day-to-day practice. For example, if before surgery or treatment, a patient believes that they must be blessed by a priest, the nurse must be able to arrange for this effectively. They should not force medical procedures or treatments on someone who declines it, but instead be respectful of their decisions based on their beliefs.
Politics, music, and religion in the French Canadian culture. Another factor influencing French Canadian culture and healthcare is their religious beliefs. Most French Canadian cultures follow a Roman Catholic religion and viewpoint. Roman Catholics are very religious, they pray regularly, as well as read the Bible regularly. Their diets vary in that they can't have red meat on Fridays. Roman Catholics have a strong opinion when it comes to healthcare and pregnancy. They don't believe in abortions, HPV vaccines, or birth control. This could result in the need for various alternative options with any form of pregnancy or healthcare. As well as providing any type of nursing care, you have to consider religious needs like a Bible or rosary or having a priest present. Politics also play a strong part in French Canadian culture. The Sikh-led NDP party in particular have been controversial within the French Canadian culture in Quebec. It's stated by members of the French Canadian culture in Quebec that people are less likely to support parties who have leaders who wear any visible sign of their religious affiliations. This sense of discrimination in politics could affect healthcare and play a role in how people see and view religion in healthcare. As a nurse who's treating somebody from another culture, you have to value and respect any religious pieces or garments and act without bias. Also, patients should have no bias or discrimination towards any healthcare professionals who wear any religious garments or pieces. Music and art also help to influence, strengthen, and establish French Canadian culture. Music and art help to establish a sense of culture and identity for the French Canadians. Music has a strong, rich history that is based on French folk songs and tells stories about French settlers in the logging and fur trade. Some French Canadian folk songs focus on cultural issues and political topics that are also present in their culture. French Canadian culture has a rich music and art, which help establish a sense of belonging and a feeling of identity within French Canadian culture.